All right, in this lecture we're going to be talking about ethical and multicultural factors as these relate to case management, but I'm sure that in this discussion there are things that you have learned from other classes that will relate to some of these issues. Well, as I said, ethical and multicultural factors are things that you hear about in all classes. The first thing is ethics in rehabilitation counseling, and there is a new ethics code in rehabilitation counseling, which you can find at the website that is listed on this slide. And ethics are, for persons who have a CRC, are an enforceable standard. And it's important to understand the ethical code and the practices and the ethical issues that we face. Now, a lot of the things that you see in the Code of Ethics are you could say, well, that's common sense, but the problems arise when we try to apply the ethics and the code to situations that are not always clear-cut. But at least the first thing we should be able to do is to understand what the ethical code is and what the ethical issues are. So I encourage you to go to the Code of Professional Ethics and review it. And case management practices obviously should be guided by the Code of Ethics. Rehabilitation counselors are expected to always, in dealing and working with consumers, take ethical principles into consideration. We should try to resolve ethical dilemmas as they arise, when they arise. We should respect consumer freedom of choice. We should protect consumers from harm and maximize consumers' benefit. And we should honor commitments and be fair to consumers. And those are some of the translations of some of the ethical standards that and principles which we adhere to. There are 5 universal ethical principles, and these fall under the domains of autonomy, non-malfeasance, beneficence, justice, and fidelity. Autonomy relates to individuals have the right to make their own decisions. We respect the individual and the individual's autonomy. Consumers have the right to freedom of choice, and individuals have the capacity for self-determination. Non-malfeasance is that the obligation to do no harm prohibits from causing physical and emotional harm to others and in the counseling relationship. This relates to a standard in the Code of Ethics, which you can look up. Harm may occur when inappropriate services are provided or when there's a misuse of assessment results. As examples, harm may occur if rehabilitation plans are not fully implemented and not carefully monitored, and the placement of consumers in a job that may exacerbate his or her disability may cause harm. We can also cause harm by saying things or doing things which are not within the framework of our skills or which go beyond the information that we have about a consumer. Beneficence relates to the duty to assist others, acting in a way that promotes the well-being of others, and it's a balance between beneficence, this concept of beneficence, and autonomy. And for example, we avoid acting in an authoritarian or parental role or approach in the counseling relationship, but at the same time we encourage the consumer to be independent and to be autonomous and be able to make decisions. Justice relates to fundamental fairness and the provision of fair conditions for everyone, equal access and treatment, and justice is both a legal and an ethical issue. It relates to non-discrimination and prohibits discrimination on the basis of age, ethnicity, gender, color, culture, disability, ethnic groups, and so forth, religion, sexual orientation, marital status, or social economic status. Fidelity relates to being honest, loyal, keeping and maintaining promises. Fidelity relates to trust and is certainly central to the counseling relationship, and trust helps build good counseling relationships. And we adhere to agreements contained in the rehabilitation plan, and that the rehabilitation, the IPE, individual plan for employment, reflects the consumer's informed choice. It's not coercive, and as I have said in other lectures, that it challenges the consumer, and it still is it's fair, and it adheres to the spirit of what the consumer's abilities are and what the consumer, under the consumer's free will and choice, feels is in the best interest of him or her. We avoid giving misinformation or inadequate information, as that can lead to harm. We maintain informed choice, informed consent, and we maintain confidentiality. In terms of generally ethical dilemmas, the ethical principles of autonomy, non-malfeasance, beneficence, justice, and fidelity provide guidance for ethical actions and decision-making, but ethical dilemmas arise when there is a conflicting choice of action. For example, a choice may need to be made between two different courses of action, where there may be significant consequences associated with taking action in either direction, and each of the two courses of action can be supported by one or more ethical principles, and that the ethical principles supporting the course of action not chosen will be compromised. So we need to deal with these things, and we need to be able to resolve these things. And sometimes resolving ethical dilemmas means speaking with our supervisors to get guidance, being able to reflect on these questions with the consumer. It means looking at our own in deciding how to respond, looking at our areas of expertise, our parameters of expertise, and knowing what it is that are within the boundaries of our professional knowledge and training and expertise. Switching over to multicultural considerations, rehabilitation services need to be culturally sensitive and appropriate for the individual consumer. Counselors need multicultural counseling perspectives and skills. We need to recognize the diversity of the consumer. It's important for counselors to be aware of cultural differences with regard to individual attitudes, values, behavior. We need to be culturally appropriate, and we need to apply counseling in a way that is responsive and understanding of the consumer, so that we don't misdiagnose and hinder the rehabilitation outcome to people who are different from ourselves. How do we understand cultures? Well, certainly we can inquire of the consumer. We can ask professionals who may be a member of that ethical or cultural group that the consumer is also a member of. We may supplement our own knowledge by reading. We may try to understand the differences in terms of family relationships and how things are done by different individuals, and we need to be respectful of people and their differences. And a lot of times cultural problems occur because we're just not being sensitive to the person. So it's always important to ask the person about a cultural issue and to ask in a way that shows respect and doesn't denigrate or denounce the person in any way, or make the person feel like a second-class citizen or a lesser person because of having certain cultural values and traits and understandings and knowledge than we do. And then finally, Some issues in cultural diversity relate to the individual versus the group. That's individualism versus collectivism. In some cultures, the individual is held in higher esteem, whereas in other cultures, it's the collective grouping that's more critical. We have concept of family and community for consumers from different cultural backgrounds, and we have indigenous healing practices among ethnic minority groups. We have psychosocial adjustment factors affecting consumers. We have sensitivity to issues where there might have been oppression, discrimination, and racism towards individuals from certain backgrounds, certain groups. We might have individuals who come from different governmental and cultural backgrounds who may view with mistrust individuals such as us who may represent government organizations or just organizations in general, and we need to understand those things. And in doing so, whoever the consumer is, we need to use these factors and to adhere to a culturally sensitive perspective in terms of also empowering the individual. So this is just a brief overview of ethical and multicultural issues. There is certainly much more to this, but these are some of the basic factors which are critical in all successful case management and counseling relationships.